very short consideration about the medical tourism, an opportunity for the system of Italian hospitals. Yes, but I think that also Italian hospital systems is an interesting opportunity for medical tourism. In the world market of medical care, Italy can be now a new interesting provider. Why? Because Italian National Health Service, as you know, is one of the best in the world. This is certified by the World Health Organization. And more interesting is that it contains a good number of very good hospitals where it's possible to treat every pathology, particularly the most complex. In the 21 Italian regions, there are regional hospital systems with public and private hospitals, all included in the regional health service. And the Italian patient can use all public and private hospitals in all the 21 regions. If we use an indicator as the case mix index, we can see that exists a different level of complexity in the different regions and between public and private hospitals. Generally, we can say that in the north of Italy, hospitals are more complex, and generally, we can say that private hospitals are more complex than public. There are too much numbers here, but if you see, these are public hospitals. These are the greatest part of a private hospital. And here you can see the value of a case mix. As you know, case mix is an indicator of the complexity of the activity of an hospital, and a greater case mix indicates that the hospital works on very difficult patients with high technology. As you see, in different regions there are great differences. This is a historical condition, but it's very interesting if we study the problem of patient mobility. Why? This situation, in fact, produces from many years a great patient mobility in Italy that increase every year. The next one, please. Oh, what is it?
The big one.
Oh, no.
So,
go back. Sorry.
That one is that one.
Oh, okay.
So back is that one. He's putting it up again now.
Just a moment. Okay. You can see here, this is a number of patients that every year move from a part to another part of Italy. As you see, it's a very great number. It increased until 2.5, but it's more interesting to see the rate of hospitalization, and the number of patients is increasing every year because Italian patients move very frequently in different regions and in different hospitals. This means that in this country it's usual that patients leave our house and go to a very distant hospital to receive care. And this is very important if we want to also receive patients from other countries. Why? Because Italian hospitals receive patients from very far. This actually happens for the most from Italian patients from different regions, but obviously that an hospital that receives patients that live very far is in condition to treat these patients and assure a good level of quality in hospital care, also for the most in complex care. How much is the value of all this? Okay, 4 billion about. And as is obvious, this is a competitive system in which some reason win the competition. And this is another important situation that induces quality in all Italian regional system. But we can ask to ourselves which kind of hospital are the best winner. Actually, this is for the most in private hospital that work for the national system. But we have also our data, which let us compare the quality of hospital care in Italy with our great town in Europe. The city of Milan and Assorbarda, which is the association of Milan companies, produced this year a study on attractiveness and competitiveness of Milano in the European context, using 214 indicators that compares these great European towns. As you see, we have Milano, Barcelona, Lyon, Munich, Stuttgart. Why this town? Because the urban complexity is nearly the same. You can see the number of people that live in this city, in the metropolitan area, and you see that there are great similarity, and more, this town are in the so-called European movement regions, the greatest, more active and more rich regions in Europe. Well, as you can see, Milano is a very good position in the score of these important 5 towns of Europe in 3 important sectors for health activities. Pharmaceutical sector, because in this town there is the presence of a great pharmaceutical industry. And medical research, which demonstrate the attitude of Milan to produce innovation in medical science, and obviously welfare in industry, the activity of our hospital, that, as you see, is perfectly in line with the greatest comparable towns in Europe. So it means that it is possible to be competitive, and this system is surely interesting for patients that come from other countries to find good, very good and high-level medical care. But obviously, also in other regions in Italy, I must say, exists a very good hospital with interesting opportunity for medical tourism. The quality and the number of Italian good hospitals, and here you can see the network of Italian private hospital, which is a member of our association, that in all Italian region generate a very, very great network of hospital, strongly oriented on the quality and high level, great complexity care in all pathologies. So we can say that probably the country is now interesting for many kind of patients from Europe and the not European other countries that are interested to find high-level medical care. And the medical tourism can come in Italy also in a human and cultural point of view, because this, our country, is very hospitable, and this is important for the psychology of a patient that can find in Italy a very good accueil. It is the time to start. Thank you very much.
Thank you.